Live from downtown Detroit, home of WDIV and Click on Detroit, Local 4 News at 11 starts now.
On the day Governor Whitmer cancels the rest of the school year, she answers questions for an hour in an unprecedented town hall meeting.
The fact of the matter is, we have to do the right thing right now.
Michigan's stay-at-home order is set to expire April 13th or 14th, but tonight the governor revealing that date may not be long enough.
Cases in Michigan now nearing 10,800 with a statewide death toll at 417. To combat the spread of the virus, tonight the state health department issuing a new emergency order. Follow the social distancing guidelines or face fines of up to $1,000.
Tonight, Detroit's television stations came together to produce a town hall for the governor for the entire state. We tried to get answers to the questions you've been asking us to ask her. Mara McDonald live downtown tonight with more. Mara, many of the answers were likely not exactly what people wanted to hear.
You know, Devin, I think the governor made it very clear that we have yet to see the worst of this virus, and it's essentially a certainty that she's going to have to extend that April 13th stay-at-home order.
Welcome to the Governor's Town Hall. I'm Devin Skillion from WDIV Local 4, joined by my colleagues Huel Perkins from Fox 2 and Carolyn Clifford from 7 Action News.
For an uninterrupted hour, the governor and Dr. Khaldun answered questions.
And I'm grateful that your stations could all come together for one cause. I think this is so important.
That you have been asking. And the one I get from most people is, when does this end? When do we go back to normal? What is the metric?
I think that's the question that no one can answer with great confidence.
What we learned tonight, unemployment claims in this state have gone up 4,000% as the number of COVID-19 cases continues to rise.
In just over 3 weeks, we've gone from 0 cases of COVID-19 to more than 10,000 in the state of Michigan. This virus moves easily from person to person. Even if you don't feel sick, you could be carrying it. And just one person with the virus can infect another 40, who can in turn infect thousands.
The governor says we're not at the peak. That could be in anywhere from 9 to 14 days. She also understands people's frustration at being laid off or seeing their pay reduced because of the stay-at-home order.
I know that issuing the stay-at-home order creates additional hardship. But here's what else we know. COVID-19 is a novel virus. It is incredibly contagious and it is deadly. There is no cure. There is no vaccine.
The TCF Center has been turned into a field hospital by the Army Corps of Engineers, but other hospitals in the state need to help.
We know that our hospitals, especially in Southeast Michigan, are at capacity. They're running out of ventilators, they're running out of PPE, they're taking care of patients in hallways. There's absolutely no reason that a hospital that is 90 minutes down the street can't, if they have the capability, take some of these patients.
Will the stay-at-home order go on past April 13th?
I would anticipate that there's a possibility that I will have to lengthen the stay-home order, but precisely how long it is and when that announcement will be made, I'm not prepared to say right now.
Back here live, realizing that we haven't yet hit peak, you can understand why the governor today decided to close down in-room classes for the rest of the school year for school kids. Instead, they switched to online or remote learning. We're live downtown tonight. Devin, Karen, back to you.
Much to still sort out there, that's for sure. All right, Mara. Karen.
Doctors and researchers around the world have been trying to find a cure for coronavirus for months now. Now, the key to stopping the pandemic might come from doctors here in Metro Detroit. Jason Colthorpe at Henry Ford Medical Center in Dearborn, where doctors are about to lead a clinical trial on a very specific drug that could be effective. Jason.
Yeah, that drug, Karen, is hydroxychloroquine. If you remember, this is the one President Trump mentioned a couple of weeks ago and put it on everyone's radar. It's traditionally used to treat malaria and lupus. Doctors have been unable to find evidence it works in treatment for COVID-19 patients. However, in a couple of spots around the world, they found that people that took it didn't come down with coronavirus. Now, doctors are rushing to prove that theory.
Today, we can announce a groundbreaking clinical trial that will help people around the world.
The groundbreaking study announced today by Henry Ford Health System is looking specifically at whether hydroxychloroquine can be used to prevent people from getting COVID-19. Doctors have been using the drug already in the treatment of patients who've recovered, but they say there's simply no way of knowing it was the hydroxychloroquine that made the difference. But that led to some hoarding of the drug, which could hinder this study.
The biggest impediment, honestly, is the availability of this drug. Everybody in the country wants it. People had a run on it, kind of like toilet paper. It was impossible to go to pharmacies to get it.
If the study shows positive results, it would change the landscape of the pandemic spread.
Dr. Frank McGeorge and other doctors are definitely energized by the thought of doctors and nurses having a shield as they treat COVID patients.
There is a lot of hope surrounding hydroxychloroquine, and this study should help us answer whether the drug can actually be used to protect people who are not infected from becoming infected.
The fast-tracked 8-week study will involve 3,000 people and start immediately.
From the scientific side, it looks promising, but not definitive. And we really need to know the answer whether or not this drug works or not. And as the mayor said, the only way to do this is with a placebo-controlled trial.
Nobody's promising any results here. We don't know. But what you've got is some of the finest scientists in America believe this has potential. And the only way we're going to find out is to give it a try. And so
open enrollment on this will begin on Monday and Tuesday, again involving 3,000 people, and they should know in 8 weeks for sure if it's working or not. Karen?
So, Jason, what do doctors mean when they call this a blind study?
Well, basically, of the people involved who will be getting 8 pills a week for 8 weeks, some will get a placebo, some will actually get the drugs, but neither the participants will know or the people who are administering the drugs will know what they're giving those. And Dr. McGeorge really has a great breakdown of what this whole study entails, and you can check it out further at clickondetroit.com. Karen?
All right, we appreciate it. Thank you, Jason.
New video tonight of the transformation that is occurring inside the TCF Center in downtown Detroit, formerly known as Cobo. The building is being turned into a field hospital. 1,000 beds being built to help relieve the burden on local hospitals that are treating coronavirus patients. Makeover is on track to be one of the fastest in the country, thanks to $279 million in recent renovations, which has really helped. Today, the city of Detroit started testing first responders, healthcare workers, DDOT drivers, all of them using these new rapid testing kits. The kits provide results in 15 minutes. Detroit is the first city in the country to begin using this new test. Unfortunately, you can't do a ton of them yet. We've only got a couple of the machines, but we'll see where this goes and whether we can ramp them up.
I said 4 an hour or so, so we can't do it to mass people. New tonight, stay-at-home order over in Washington State gets extended through May 4th.
Also, President Trump expected to issue new guidelines on whether Americans should be wearing masks when they head out for essentials like groceries. Susan McGinnis has the latest from across the country and the toll the virus is taking on the economy. Susan?
As the coronavirus toll continues its rapid rise, more evidence of the economic freefall. Today, word a record-shattering 10 million Americans filed for unemployment in the past 2 weeks. The White House promising a government lifeline to small businesses as part of the just-passed emergency aid package.
So that begins right away, and they start handing out checks, and a lot of people are going to have their businesses built back up quickly.
You get the money, you'll get it the same day. You use this to pay your workers. Please bring your workers back to work if you've let them go.
But hours before applications were set to begin for the loans, banks complained they were still unclear on the details. Also, confusion about how and when Americans are going to receive direct payments.
Within 2 weeks, the first money won't be in people's accounts.
While some will see swift direct deposits, others may have to wait weeks for a paper check. The administration also deflecting criticism for refusing to open Obamacare coverage for people without jobs and insurance. Vice President Pence promises an announcement that healthcare providers will be reimbursed for treating coronavirus patients who can't afford it.
We don't want any American to worry about the cost of getting a test or the cost of getting treatment.
But with cases still skyrocketing, the president's task force coordinator expressing frustration that many are still ignoring the social distancing guidelines.
And I can tell by the curve, and as it is today, that not every American is following it.
Another potential guideline still under intense debate, whether Americans should be told to wear cloth masks in public.
Susan McGinnis, Local 4.
All right, Susan. Well, it finally felt a little spring-like today, didn't you think?
I think so. I think you said, what, you ate lunch outside?
Just
Isn't it funny
that I had,
when
yes.
it's nice, you just want to run out there for just a little bit of vitamin D. Were you able to enjoy a little bit of that sunshine today then?
Little bit of it, yeah, and we've got more of it tomorrow, Karen and Devin, and even into the weekend. It's not going to be a complete washout, although you'll see there are some showers ahead. We've got clear skies tonight. That does mean that we're going to get chillier than what we woke up to this morning, so just be bracing for that as we head towards tomorrow. And in fact, some of us already in the 30s. Ann Arbor 39, Lapeer at St. Mark, Port Huron 34 right now, and officially we're still at 46. So here's a snapshot of the weekend, and we will spend the daylight hours dry on Saturday, see some late showers, and then dry out for the definite pick of the weekend on Sunday, 65. And that is not the last of the 60s. We'll look at next week, a pretty active pattern setting up, and find out how long those 60s will last in just a few minutes. Guys?
All right, thank you, Ben. It is the last thing anyone should be doing during this health crisis.
Masks aren't going to help these folks caught fighting on camera in Detroit. You'll hear from the man who shot this video about what was going on. Paula.
Schools closed for the rest of the year. What next, particularly for some of the wealthier districts that may not be as wealthy anymore, as the gap is closed because parents are simply losing their jobs, which means food security and connectivity is disappearing as well.
You're stuck at home.